Hi, welcome to this presentation on eCareAgora, a solution suite for entire healthcare ecosystem. I am Mujitha, Director of LongRiver Infotech Group. Our long-term vision is a healthcare platform which connects all stakeholders in the healthcare ecosystem. This platform will have analytics at its core and will facilitate B2B transactions among the providers in order to fulfill seamless and integrated B2C services for citizens. Our focus area for this discussion would be consumer health, which is targeted for all citizens. What is the need for a consumer health platform? There is a huge demand for customer-centered healthcare system, and this platform fulfills this need. Using analytics and predictive diagnosis, recommendations are tailor-made for each individual. We'll start with personal risk factors. Won't it be nice to receive personalized recommendations on health programs and diagnosis checks? Personalized consumer health is our differentiator. For this purpose, we need to record and track personal risk factors. These include risk factors across various categories as noted here. A sample of chronic risk factors is mentioned here. We will glance through other categories in the demo. Coming to routine tests, have you ever thought you and your family need to be informed on the routine tests and diagnosis checks? We support recommended screenings across all categories mentioned here. This is a sample for young adults. All tests mentioned here are a mandate for an young adult. These include tuberculosis, diabetes, HIV, hepatitis B, breast and cervical cancer. Based on last tested date and a recommended frequency, a next due date is calculated and shown. A risk level indicator for this condition is also computed from this person's individual risk factors. People can also take a risk assessment for this disease. Complications which can arise as for this condition is also available. All these serve as demand creation mechanisms for these tests fulfilling evidence-based preventive care. Coming to risk assessments and risk factor metrics, have you ever felt the need to have a preliminary online risk assessment before approaching your provider for the diagnosis tests? This also is a booster for evidence-based preventive care. It helps overcome the stigma associated with preventive health checks, like I don't have diabetes, why should I bother about these tests? Based on age, gender, and ethnicity and a series of questions, risk level for an individual for a specific disease condition is assessed. A sample questionnaire for diabetes is shown here. Once a person takes up this questionnaire, based on predictive diagnosis, a risk factor matrix is generated which shows risk indicators against each risk factor and various disease conditions. For diabetes, these risk factors include overweight, obesity, physical inactivity, family history, ethnicity, and the conditions include pre-diabetes, type 1 or juvenile diabetes, type 2 diabetes, gestational diabetes, etc. Indicators against signs and symptoms are also mentioned here, which is a strong proof to take up diagnosis checks. For health programs, the ecosystem consists of providers mentioned here, and these programs, a wide variety of these programs are conducted in high impact places and also places convenient to citizens. Program organizers, clinicians, and allied health providers facilitate rolling out these programs to various citizens groups at these locations. These programs occur across many categories, and a sample program on kidney disorder screening camp is shown here. A summary session is there, and risk assessment can be done for evidence-based care. Based on a risk level, people can take informed decision on whether to attend the program or not. Appointment option here provides the contact details of the program providers. Health insurance policies are also suggested to citizens based on personal risk factors, preventive care, and treatment needs. So this completes the complete consumer health platform. Thank you.